If you're going to have a knee replacement, or if one of your family members is going to have a knee replacement, then you need to listen to what I'm about to tell you. What's up, y'all? This is Not a Real Doc DPT, and today we're going to be talking about something that a lot of people need to hear and need to understand. This is so critical, and we'll start off right at the top. Look, if you are planning on having a knee replacement, if you are not going to do the exercises that your therapist is asking you to do, you should not do the surgery. It's that important. Look, they're unlike knees are not like other orthopedic joints necessarily. Your hip, your ankles, your back, even surgeries. Yes, movement is important for those joints, but a knee, if you do not move it and get it moving early on, then it will stiffen up and you will lose that range of motion and it will be extremely difficult to get it back. This whole video is I'm getting frustrated even as I talk about this. This whole video is being um, done because of a patient that have been working with, and it's it's very frustrating. Um, Look, you need to understand the first 2 weeks after a knee replacement surgery, they're just gonna suck. Okay, there is no way around it. There is no getting over it. It's gonna suck. It's gonna hurt, and it's gonna hurt a lot. Okay, knee replacements are one of the most painful surgeries that you can have. Usually it's considered that it's a toss up between a knee and a shoulder replacement as to which one is the most painful. But you need to understand there's going to be pain involved. Your surgeon knows that this is not a pain-free surgery. That is why that your surgeon is going to or has already prescribed you some of the higher level um, pain meds for you. So getting into some of the opioids like the oxycodone and the hydrocodone. It's why he's giving you tramadol. Those pills are made for this type of a surgery to help you through this process. You're supposed to take those pain pills and then do the exercises. Uh, You, the worst thing that you could do after a surgery, especially after a knee replacement surgery, is to just sit and not move. And on top of that, sit and not move, and then not move your knee joint that you just got replaced. It will stiffen up, you will lose range of motion, and that will lead to not good things in your future. Okay, including a complete redo of the joint. It is so critical, and it's so frustrating sometimes when you encounter patients that, despite your best efforts, will maybe do some exercises while they're with you at the clinic, or while you're standing over top of them, but then on their own they do nothing. And there's if you're going to do that, as I say, there's no point in even doing the knee replacement. Okay, um, your there are a few things that your therapist is going to give you, especially early on, that are critical for you to do. The first one is going to be, well, the working the knee, as I just mentioned. You're going to need to work on bending your knee and straightening your knee. Of those two things, they are both critically important to get back. Of the two of those exercises that you will be doing, the straightening is the most important. The bending your knee will come. Okay, life is about flexion of your knee. You're constantly bending your knee as you're going up and down stairs, as you're standing up out of chairs, as you're getting in and out of cars. That knee joint is going to bend. Yes, you do need to work it. Yes, you do need to work to improve that. Um, Usually within the first 2 to 3 weeks, we're trying to get you to at least above 90 degrees, preferably above 100 degrees. And then you continue to progress with outpatient, and then we're trying to get you a lot of times to like 130, 140, but trying to at least generally try to get at least above about 120 to be so that you have full function there. So that's with the bending of the knee. So it is very important to get that going, but more important than that is to get your knee straight. And when I mean straight, I'm talking getting it locked out straight where it can get to actual zero, where your knee is completely straight and locked out. The reason that that is so important and that is so critical for you to focus on in those, especially in those early weeks after a knee replacement, is your full extension of the knee does not have to return. You can live your life without fully and completely straightening your knee. But then what's going to happen is the component parts that your surgeon put in to your leg, it's not going to wear correctly with the other bone, or with the bone that's around it. It's not going to move correct. And you're going to wind up having increased pain in probably a year to 2 years in your knee. And then you're likely looking at a redo of the entire knee joint. So I know I'm not kidding about that. That really does happen. Or even worse than that, is I have had these patients in the past where, for whatever reason, whether like a few of these people I didn't see from get go, so I don't know what happened necessarily early on, but I've had patients who their knee was completely, they were locked out of full extension. They could not, their knee would straighten to where it was still had a slight bend in their knee, like no matter what we did. And those oftentimes the surgeon would go back in to try to do a release and cut through scar tissue that had adhered and all that. We would do everything we could to try to get it to bend, putting patients on bikes and all sorts of things. And I'm sorry, trying to get it to straighten by just working it and using weights, even having people lying on their stomach, trying to heat it up and trying to just all sorts of stuff, manual therapy, trying to release all the muscles. It can be incredibly difficult to get a knee to straighten if the patient is not doing the exercises that they're supposed to be doing. Then conversely, it can, same thing. I've had patients who could not bend their knee. And so now we're trying to do everything we can to get that knee to bend, putting them on bikes, also trying weights, trying manual therapy, trying all of this stuff, trying all these exercises to get it to be able to bend. So much of those types of problem patients could have been corrected, and if they had just early on really, really been diligent about doing the exercises that their therapist gave them, focusing on the bending of the knee and the straightening of the knee, even when it hurts, even when it's painful. That is what the pain meds are for. You look, you have got to do the exercises. It is critically important, or you're going to run into major, major problems. And you need to go back and look at the video that I uploaded the other day, which is, don't make any mistake. Your situation can always get worse. Okay. So things don't necessarily have to get better. They can get worse. Believe me, the physical therapists, we work with those types of patients all the time. Okay. Yes, this is going to hurt. Yes, it's going to be a challenge to do. However, knee replacements can be some of the most successful surgeries that there are. Most, and the vast majority of patients will tell you about 6 months or so after their knee replacement that this was the best thing they ever did, and they wish they had done it sooner. Okay. So, but those are the patients who did the work. They actually got up and walked. They actually put weight on it and moved, walked around, follow the appropriate assistive device, using their walkers, and then as they progress, using their cane, then going from there, they push through that pain early on. Because let me also tell you, that pain, it will get better. Okay, it's the first 2 weeks are the worst. It can still linger on a little bit after that, but it does get better if you do the work. If you don't do the work, it doesn't have to get better. And in often cases, like I'd mentioned, it can get worse. Okay. So you need to understand the reality of replacing your knee joint. It's going to hurt. That's what your pain meds are for. And it's going to require you to work. Okay. There is no getting around it. There is no going like avoiding it. The only way forward with a knee replacement is through that pain and working into it and coming out the other side. And if you can do that, or when you do that, as I say, you in probably 6 months from that time will be saying, man, I wish I'd done this sooner. This is the best thing that I ever did. Okay. So there is hope to this. It is a process that a lot of people have gone through, and a lot of people will continue to do. But you need to just understand how this is all meant to go, and how you get through it. Okay, so we'll be saying prayers for you that goes well for you. And if this video is something that seemed beneficial to you, if you would hit that thumbs up button. And if this channel and you like this content talking about physical therapy more so from a patient perspective, and what things that are there that could help you to get through your physical therapy appointments, etc., etc., then please subscribe to the channel and give us a follow. All right, we'll catch y'all next time. Later.